You are listening to the Miami Center of Excellence podcast. At the Miami Center of Excellence for Obstetrics and Gynecology, we believe every woman is unique and special, and we want our patients to look upon us as their partner in good health. Read all about our treatments by visiting us at www.miamiobgyns.com. Today's topic is the epidural debate. Here's what you need to know. Preparing for a birth, especially at first birth, is important. This is why many first-time parents attend classes, read books, and brace themselves with the knowledge of what to expect before heading into the delivery room. Many soon-to-be parents go into the delivery room with their mind set about the big E. But things happen. Parents who had planned on a drug-free delivery find themselves in a situation where getting one is a medical necessity. Or a woman who had planned on getting one can show up to delivery already too far along to receive it. So before you continue, know that, while educating yourself and creating a birth plan is important, the safety of both mother and baby trumps all. Here's a rundown of what you need to know about the epidural debate. Statistically speaking, epidurals are safe for mother and baby. Permanent injuries such as paraplegia or long-term back pain are as rare as they are extreme. In 2009, the British Journal of Anesthesia concluded the risk was 1 per 20,000 or lower. Most complications, such as headaches or lower back aches, are relieved within a few days after the birth. The reason women take an epidural during labor is to relieve the pain of contractions. Once the epidural kicks in, the mother can benefit from some R&R as her cervix continues to dilate in preparation for the birth. Ideally, the epidural wears off enough in time for the pushing stage, and the mother has enough feeling in her pelvis and legs to purposely push her baby out to be born. There are a few caveats. 1. Epidurals do not necessarily relieve all of the pain. 2. It's impossible to plan the timing precisely for pushing. Therefore, when accepting an epidural, keep in mind realistic expectations. Women who choose to forgo the epidural are usually able to do so because they use natural means to relieve contraction intensity. Coping mechanisms include relaxing the body with comfortable positioning, hot water bottles, warm showers, massage, singing, hypnosis, dim lighting, smiling, and hearing encouraging messages from others. Other techniques are useful, such as lowering the shoulders, releasing the jaw, softening the cheeks, and leaving the fingers open instead of clenching them. But these natural pain relief techniques are not for everyone. More than half of birthing women use an epidural for contraction relief. Every woman can weigh the decision about an epidural for herself. Do your research and prepare for the type of birth you prefer. And if it's not what you intended, take everything into consideration. Give yourself huge kudos because no matter how the birth transpired, you gave birth. You went through a lot to have a baby. That's your story, and that's amazing. And if you want to plan differently for a consequent birth, you can. Thank you for listening to the Miami Center of Excellence podcast. You can contact us by phone at 305-615-6147 or by email at info@miamiobgyns.com. Learn more by going to www.miamiobgyns.com.